Good morning, okay. 7:34. Happy Monday to you. All right, I asked the question. Okay, if a pet gets sick, you got to have somebody that knows what they're doing. We want somebody who has some knowledge, who cares, or even if they want their teeth brushed. I mean, you kind of need like a wide array, like because it's tough even washing. I know little kids' teeth too. That stuff. Dr. Andrew Pierce knows about all ends of it. How you doing, sir? Good morning.
Doing well. Thanks for having me, guys.
Absolutely. Dry Pond Animal Hospital, located in Denver, with the pet resort. And I do feel like you need to put the plug out on the pet resort now because holidays are right around the corner. So give us the skinny on the pet resort first. Is it like a pool, or is it like a tunnel, or is it just like stay in your cage all day? Like, where is it at on what people can expect?
This is somewhat uniquely. We let the pets stay out a whole lot that are boarded in or come by for us for daycare. We do have a pool, which the pool season is wrapping up a little bit, but we still got some nice days left for the pets like to get out there in the pool. But no, we'd like to have them spend out a lot of time outside on our turf, and just hanging out with each other out there.
Are you an expert at, like, you could probably throw the ball and get all of them to go? And do you play with do you guys play with them and everything like that too?
We do. Like, I don't get out there as much as I'd like to. I mean, that's the fun part, right? I mean, but we got a lot of staff that really enjoy playing with the dogs and enjoying their time out there. And we have all sorts of toys and things for them to jump up and down and around on, and some do it more than others. We've got some senior, bigger dogs that just prefer to come and lay and hang, and that's cool too. Whatever they're down for.
And it's sad when you have to go just see your vet when your pet is sick, but to be able to have a place too you can go to also for happy times when you're going on trips and vacations and have really that relationship, and it's kind of looking at your pet as kind of family, right? Like,
yes,
it's really
it definitely is. It's part of your family.
And so you were telling us that you've got a new concept of holistic, kind of more looking at your pet, or give us the rundown of what you guys are working on over there at Dry Pond.
Yes, we kind of have a new idea. We're calling it a longevity consult, and so this is more for like people that have had like middle to later age pets that are interested in like what can we do to help them live longer, and we're trying to look at things like you said holistically, like from all the way around, like as far as diet goes, is there any supplements that could help out? I even try to think of like, how is this pet doing in the home, like mentally? Are there stressors? Because we know like stress, really takes a toll on our life in a lot of ways. And so, can we do anything to kind of keep them calm? Is spending time at like a pet resort where they're spending time in a pack? Is there like middle age? Like, is that something that like is great for them to get that exercise and those kind of things? And then all the way up through like you think of vaccines, or like, is this particular pet on the forefront of experiencing any signs of osteoarthritis, or they had a healthy weight? So these are all things that we kind of want to take into consideration. Sure, like we can talk more about like blood work or dental care in that same window to help these pets live as long and healthy as possible.
All right, so humans, obviously it matters what we eat. So for animals, it matters what they eat. Okay, chocolate. Have we talked about chocolate before?
I think we touched on it last time a little bit. Chocolate. Is there anything else that pets shouldn't eat though?
Like, what about like mac and cheese? I put a little mac and cheese
table
in the
food
bowl.
in general?
Yeah, table food is certainly a common scenario for folks.
It can be. What I advise most folks is like, if you're going to give your dog something from the table, just make sure it's lean. A lot of times these dog foods that they're eating are pretty lean. And so where you'll get into trouble is if you were to give a dog something really fatty that they're not accustomed to. Like I got a 5-pound Yorkie. If we drop a piece of steak, one of my kids does or something, a lot of times they'll cause them to have a little bit of stomach upset, and it can be of varying degrees of severity. But yeah, just be careful with the fattiness of it. So mac and cheese, I'd be steering away from perhaps. But if you had like a piece of grilled chicken, generally most dogs, that's going to be just fine for it, depending on like, as long as they're not like a spices or anything like kind of funky on there.
See, then you get the opposite end of the spectrum too, of cats who won't eat the human food at all.
Cats won't eat human food at all?
Throw up on the carpet just because it's Monday morning at 4:30 in the morning, and that's
cats are going to be cats, and no one ever really knows what a cat is thinking. Like we have all these ideas in vet med, and like even at my emergency animal hospital, for instance, we have a room set aside so it's a little bit quiet, extra, just quiet and easy for these cats. So they're not in all the hustle and bustle. But I tell people all the time, like, we don't know that that's what cats want. No one knows what a cat wants at any given moment. They're weird animals. They're great animals, but they can be challenging.
Veterinary services, is it annually is the kind of schedule, at least come in and have an annual for your pet?
That would be our goal. And then there's a lot of folks that we're running into that have been to this animal hospital and that animal hospital. And sometimes your vaccines get kind of out of whack, or maybe, you have a heartworm test due in this month, and then your annual vaccines. So we're trying to really, sync that all up to one visit per year per pet. You give me a senior pet, you get over, 10, 11, 12, 13. I'm going to start to say, like, we probably should be seeing them twice a year, just making sure we're not overlooking something and at least offering that. And talking about ways to make sure that they're happy and healthy as long as possible, those kind of things.
Trying to think, like, if I ever had a breed of a dog that would live that long, 10, 11, 12, like it was probably like 7, 8, 9. But again, we were giving them mac and cheese from the table, so you can imagine.
Right.
So now
and Justin likes to remind people that I had outside dogs as
Hey,
kids.
me too. Hey, you weren't the only one. Yeah.
All right. I wasn't the only one. But one thing that is a new thing I've never heard of is dental care for your pets.
Yeah.
Is that something that's important to keep up with?
For sure. And there's a lot of data to support that. We went to a CE not long ago that was saying that like between 60 and 80% of dogs are going to have a fair amount of gingivitis. At Dry Pond Animal Hospital, we've got a new idea that we're really rolling out in the new year, and it's going to be to do what we call like this dental cleaning and x-rays for a pet. And so we can quote that to you for your dog's weight range and go, hey, this is going to be, somewhere between $500-$700, and let's get them in, let's check it out. And there's going to be varying degrees of severity, just much like us. And sometimes we don't know until we get in. And so we can give that quote, we get them in, we'd be able to do the dental cleaning and x-rays. And then we would be able to talk to you that evening and go, hey, everything looked really good for Fluffy. We got everything cleaned up. You should be good for the next several years. Here's preventative measures. Obviously, we touched on earlier, we talked about brushing dogs' teeth. And it's really challenging to get people to do that. Is it ideal? It's going to help. But there are other measures, like there's some dental chew treats called CET chews.
like brushing teeth with like Crest and like, so it's all like with peppermint
no, Layla
flavor, or
Layla has some bacon flavored dog toothpaste.
Yes, they got bacon and peanut butter and beef flavored dog toothpaste. But yes, like there are preventative measures and those kind of things. But then, if Fluffy were to happen to have like, oh man, these teeth look kind of rough, we may need to extract one. We would bring in like, hey, look at the x-rays here. This is what we're seeing, and this is how we know this tooth needs to come out. This should take X amount of time, and then we could give you a quote for what that oral surgery would cost the next time around. We would really could significantly discount the anesthesia the second time around, and then be able to take care of that pet's mouth.
Are dogs like sharks? They get unlimited teeth. Is that a thing? Are they like them?
No, they're more like us. They get a baby teeth, and then the baby
yeah.
teeth fall out, and then their adult teeth come in, and they're set for life with the adult teeth.
Okay, well, never mind then. We'll go back there. Veterinary services includes. Does that include emergency scenarios? Do you guys do emergency vet work as well?
For sure. We're really able at Dry Pond Animal Hospital to really take on about anything that's going to come in. With my background in emergency medicine, I'm able to help out with the staff there, and I would say the veterinarians there, as well as our technician assistant staff, are comfortable with people coming in same day sick. Varying degrees of severity. And the cool thing about Dry Pond too is like, if you're not aware, is it's 0.2 of a mile from Denver Animal Emergency, the main emergency hospital there in Denver, North Carolina. And so if something comes in, we run some labs. Things are worse than we expected. This patient really needs to be hospitalized. It's just a short drive right across the street. We communicate with them often. I'm also the medical director there to be able to say, boom, here's the records. Here's what's coming. We know all the vets that work there back and forth. So really great relationship back and forth there.
For those who hadn't heard your story yet, what got you excited about getting into veterinary services or just working with animals? What was that moment in life where you're like, man, I want to do this?
Funny, maybe point out, like, we grew up with outside dogs.
Yeah.
And so
I'm not the only one.
Yeah. So I grew up on a 385-acre beef cattle farm over in Harrisburg, North Carolina. And we had German Shepherd dogs. We had hunting dog labs that people that did a lot of hunting. So like that's the way we grew up. So I was always with animals. And then a short part of my story or testimony is that I thought I was going to be a teacher in high school. I was finalist for Teaching Fellows Scholarship. The day of my senior prom, I got a letter that said I didn't get it. And I was like defeated. Oh, man. And my uncle happened to be a vet. He came in, threw his arm around me and said, you don't want to be a teacher anyways. Come work for me. And so I started working for him, and then I started doing well in biology at UNC Charlotte, and I was like, okay, I'll try to get into veterinary school. And everyone's like, oh, it's so hard to get into vet school. And I was like, okay, well, I just kind of kept trying and figured out along the way and got lucky enough to get into North Carolina State. And that's when we kind of knew, vet was going to be our path going forward. Came back and worked general practice for 4 years, and then I founded Denver Animal Emergency in 2016. A lot of crazy hours, lots of several overnights getting that business off the ground. Found a couple other vets to come and work with me. And then in 2018, we were able to take that to 24 hours. And then 2023, we merged with what's called Blue Pearl, like a corporation there. And that's when we decided to purchase this building and land that is Dry Pond Animal Hospital and Pet Resort now.
DryPondAnimal.com. Dr. Andrew Pierce. Thank you, sir. We appreciate you.
Thank you, guys.